Started. Well, welcome everyone to the first session, I guess, this fall of our Innovation with LNEC Education series. We are so excited to have y'all. We have lots of first-time attendees, lots of return attendees, and lots of familiar faces we've seen the last 2 summers at our faculty workshop. So great to have y'all here with us today. This webinar, well, first I should say, I'm Megan Lippy. I'm one of the LNET co-investigators supporting schools of nursing, joined by Andrew Davis, my partner in all of this great work. And we thought it would be helpful for this first series, or this first webinar for the fall, to spend some time reviewing all of the resources LNEC has for faculty for free to do this work related to palliative care education. Really sort of centering this on how do we utilize these resources to prepare practice-ready nurses, to also utilize all of these things in different ways. So we thought, because we have a lot, and we've rolled out, I should say, over time, all of the different things. We've shared different resources at different times, but we haven't really taken that time to say, okay, how do all of these work together to support you in your work? And so that's what we want to do today. And also then open up an opportunity for y'all to ask us questions if you've got any sticky points that you're trying to work through, to share with one another as well. So with that, we'll get started. We always like to acknowledge that the work Andrew and I do is funded by the Cambia Health Foundation grant. It allows us to have the time to do this work to support faculty in schools throughout the country. And we also are LNET co-investigators, which means our role is to support schools of nursing, but we are first and foremost faculty at schools of nursing. So I am a faculty at UT San Antonio, and Andrea is at the University of Portland. So we are doing this work
Portland,
alongside you.
In Oregon, not the other Portland.
Okay, so
Do we have
another
another slide we need to show?
Yeah, one more slide.
Okay.
Yeah. So before we take you on the journey across all of these different resources, we thought let's just take a moment and share with you what all these resources are. You're going to see in this webinar, we're actually going to be toggling across these different resources. We'll be sort of showing how you move from one of these to the next. Before we start jumping around, let's just review what we have available to you as faculty. Everything for faculty is free. You don't pay for any faculty resources because it is important for us that you're able to do this work. We know with current budget situations, cost is a big issue, and we don't want anyone to have cost be a barrier. So the first resources that you'll see that we'll talk about is our palliative care competency statements. We call them CARES and GCARES. CARES are for undergraduate, GCARES are for graduate. These competency statements have been endorsed by AACN. And you'll see as we work through our resources today, our team, the team who worked on these, took the time to align CARES and GCARES with the AACN Essentials. So you're going to see that we've mapped CARES to the entry level sub-competencies, and we've also mapped GCARES to the advanced level as well as the concepts. So we'll show what that looks like in a second, and really how you use that document to help you with this work, because we recognize there's a lot there. So we thought we'd share some examples of how you might use those. We also have online curricula. They're each 6 modules. There's the LNEC undergraduate, new graduate curricula, which has, it's all about primary palliative care for the entry-level nurse. And we also have LNEC graduate, which is again 6 modules. Those are for advanced level students. We actually had the brand new edition, the updated LNET graduate went live this summer. And one of the big changes we made was to really be thoughtful in our languaging to make this about all graduate level nurses, all advanced level nurses. So even if whether you teach in an APRN advanced program or a program that's not for APRNs like informatics or education or administration, the language now applies to all graduate students with particular note when there's unique things for APRNs. So there's some exciting changes in that. Faculty get free access to those. So if you are not currently using those modules, or if you're curious what they are, you email LNEC and we give you free access. So again, faculty don't pay for anything. We also have created faculty guides. So for each module of undergrad and each module of graduate, we also have a faculty guide that is full of teaching strategies that we have aligned with the content throughout the course, the module. So we'll show you what those look like in a second, but these are intended to be just idea repositories for you to think about what strategies might you use in the classroom. You adapt them however you want, but it is Dr. Davis and I and our colleagues have collated lots of resources for you to use in your classroom. And then we also, last thing, is the LNEC Faculty Corner, which is our faculty website. It's housed on the AACN webpage. So you can kind of see the teaser here at the bottom of the webpage. But LNEC is housed within AACN. So if you look for us and you're like, wait, I'm on the AACN website, you are in the correct place. So it's there, and it is it's a website full of teaching resources, evaluation resources. We have a Hall of Fame that recognizes schools throughout the country who have been using our LNET curricula, and there's different levels depending on how long they've been using those. And we also have, this is where you can access our GCARES, our CARES competency statements. So
We're gonna
lots of things.
we'll take you a drive-by in just a
Yes.
second. We do have a question from Vivian about whether or not I believe the question is related to the modules, whether or not they're appropriate for associate degree or LPN graduates.
That's a fantastic question. So the undergraduate, new graduate is for entry-level RN is really the focus. So it would be absolutely appropriate for your ADN students or BSM students. That said, there is so much good content in there that I could see value for LPN. It just might be where the faculty have to help those students think about what of this content applies to their scope of practice. But what primary palliative care is, what serious illness is, doesn't change depending on their role. So it might be where if you use that in the programs, it's still helping the students learn about their scope. So because
I would.
most of it's really just about how you are with your patients and what, knowledge, that sort of thing. So
I think it's really, you might just notice, folks, that some people are popping in the chat different ways that they're using the modules, which is great. So keep it coming in the chat, and we'll just keep on rolling through these resources.
And I do want to thank Suzanne, who mentioned using it in residency programs. The reason LNEC undergraduate is also named new graduate is that we recognize that the content in that is good for students in their pre-licensure coursework, as well as those entry-level nurses who are new graduates who maybe didn't get that content. It still applies for them. So that's where that naming comes from, specifically so that it could be used in residency programs. With that, so we thought we would take you on a little journey. First, let's just show you the faculty corner because we'll be visiting that fairly often throughout this.
I'm sorry to have to share the whole screen, but I'm moving between a lot of documents, so it's probably the best way to share with you. So let me know if you are able to see, if it's big enough. You can keep me straight on that, Megan.
Sure. So
There
this
it
is the
is.
LNEC faculty corner. As you scroll down to the bottom, this is where you'll find all the links to all those different resources. Our upcoming events, so our webinar, we record every webinar that we host. So under the view recorded sessions, you can go back and see any webinar that we've had. And yes, we can put the link in the chat. You can also just put in your search browser LNEC Faculty Corner and it takes you right there. But we can put the link, Andrew, if you don't mind.
Yep.
And then again, our GCARES, our care statements, information about how you get the online curricula. It's not where they're not there, but how you would go about
Sorry.
accessing it. We do have other faculty across the country who provide support to schools as well. So we have those faculty named on our regional support tab.
We have one of them here on the call.
Yeah, Teresa's here.
Dr. Jisbus here
Yeah,
from
Creighton
Shout.
University. Yeah. Anyways, teaching evaluation resources are Hall of Fame. All of that's here. So if you see us jumping around, just know we're going to start from this LNEC Faculty Corner homepage. So
I wanted
with
to also recognize Dr. Godzig here from ACN,
Hi,
who
Kathy.
may jump in and answer some questions or offer a little information from your perspective from ACN.
Yeah, thanks for having me.
All right. So let's go on a journey because again, our hope with this is to show some examples. By no means is this exhaustive, but just some examples of how you might utilize these different resources. So let's say, for example, you are in this world of competency-based education and you're trying to figure out how do I help prepare my students to be practice ready, whether it's at the undergraduate, at the graduate level. That's where we start from is this. I'm trying to do this work. We recognize a lot of schools, when we think about the spheres of care, the sphere of hospice, palliative supportive care is one that for many schools is the one that might need the most consideration. The other ones maybe are well embedded in the program. This is one that's like, where does hospice, palliative care show up? Also, there's some faculty who wonder, what does this mean? What does hospice palliative supportive care mean? So a good place to start is with our CARES or our G-CARES statements. These statements, again, are competency statements for primary palliative care. So the care that a nurse or an advanced nurse would provide to patients with serious illness anywhere that they live. So this is not healthcare setting specific. This is caring for patients with serious illness and their families. You can maybe make it a little bigger if you wanted to zoom in just on the web page.
Okay.
So let's say, for example, I'm teaching an undergrad, and we will have some examples for graduate, but let's say I'm teaching an undergraduate and I'm trying to figure out what do I want to do with my students? And let's say I'm teaching a course where we are already, as part of that course, teaching communication. And I see there's this care statement number 5, communicate effectively, respectfully, and compassionately with patients, families, interprofessional teams, and the public about palliative care. There's a lot there. You're probably doing a fair bit of that already, but maybe it's that palliative care context that needs to be elevated. Maybe you're teaching about communication. So then you think about, okay, I'm trying to create practice ready nurses. I have this competence statement, but what does it look like? What do I want to, how do I know a student has done that? One thing that you might want to look at next is our alignment document.
Coming at you.
Yep. Which
So
actually, if you go to the CARES or G-CARES page at the very bottom, there's a link to these alignment documents. It's that third document
right here.
there.
So let's just open that one up.
Yeah, we'll just do it that way. And when you
I'm
go
gonna
into
have
this,
to make it a little bit bigger for you. We're going to go past the statements. Here they are. We just saw those in another form. And she mentioned the G cares, which will come. Oh, they're not right behind it. So we'll just stop right here.
okay, so we're going to scroll to CARES statement number 5 because that's the one we're interested in. That is our competence statement when we're trying to develop practice ready nurses who can communicate with patients within the sphere of hospice palliative supportive care. And now, so when you look at this alignment document, what our team did when we created this is we looked at our statements and then we looked at the essentials across the domains, the competencies, sub-competencies, and concepts. And our team said, based on our knowledge and understanding of palliative care, could there be situations in which we see that this CARES or G-CARE statement aligns with a sub-competency or a concept? This does not mean it will always happen, right? This is where then you as a faculty member can think about what are you trying to accomplish with your teaching? What are you trying to have students develop as a skill or a competency? So let's say I'm wanting to do something in my course where I'm really wanting to lean into student communication with the interprofessional team, for example. Well, then I might look at, okay, wait, so this statement aligns with domain 6, which is interprofessional partnerships, and it's all of these other numbers that these subcompetencies. Then I'm going to pull up the essentials document and read those and think about, do I see where with what I'm trying to develop with my students, do I see any of those subcompetencies also fitting? They may not all fit, but as you envision what you're trying to have your students do, what you're trying to have them learn, do one or more of those fit? Or let's say I'm not interested in the interprofessional piece. I'm really wanting to focus on the patient communication piece of this. Then I might say, okay, where is there fits with person-centered care subcompetencies? And reading those statements and seeing with what I'm envisioning, wanting my students to develop and to demonstrate, is there an alignment there? So not all of these will fit. Maybe you find a few, maybe with person-centered care, there's also an element of professionalism that you want to bring into this. But that's how you can use this document, is to say, as I'm envisioning developing my student competence with communication, how does this also fit with the essentials? And not forcing fits, but where do we see those alignments sort of organically occurring with what you're envisioning doing in your classroom or having your students develop?
I wonder if we, before we show the next or talk about the next phase, if we just stop for a minute
Mhm.
and see how people are doing with this. Is this resonating? Is it, do you have questions?
You can use thumbs up, thumbs down
And
emoji if you want to,
also,
or
if
chat, or if you have questions.
Dr. Godzik has any thoughts at this point.
I see A looks good. Some thumbs up. Okay. Please note you can stop us at any point, throw
Yeah.
questions at the chat. If we're hoping to take you on a journey where you're alongside us. If you feel like we've taken an exit ramp and you missed the exit with us, stop us and have us come back, because we want to make sure y'all are this is making sense.
Yes.
And this came out of, by the way, our summer workshop, recognizing that we share all these resources and there's a need for, all right, how do they work
How do
together?
we put it together?
Yeah. So, okay, so we're all in the space of, all right, I'm going to lean into maybe what I really want to think about is communication for my undergrads around advanced care planning and about communicating with patients and families. So I might lean into some of these person-centered care alignments. Now let's scroll down a little further and let's look at the concepts, because again, we've also mapped all of our cares and G care statements to those concepts that AACN has.
Sorry, y'all.
There's a lot of
Taking
alignments, but
long.
again, not all fit. You have
Here
to
we
think
go.
about. So with 5, okay, communication. Well, obviously communication is going to align with the concept of communication. But maybe there's an element of compassionate care here as well that I see with advanced care planning. So, okay, with that in mind, now I've envisioned I want my students to be able to demonstrate for me communicating around advanced care planning with a patient and a family. How do I get them there? I know what I'm looking for. How do I get them there? So that's where all of these other resources could come into play. So let's first say, all right, I don't have the faculty guides. I'm not currently using the LNET curricula, which is fine. I'm going to go to the faculty corner. And I know there's this area for teaching resources. So let me just explore opportunities there. So as you go here, we have a whole host of different resources. You'll see there's podcasts, case studies, sims, we have publications, there's some digital media, some videos, um, different presentations, posters, all sorts of things. But let's say what I'm really wanting to do is a simulation. I'm in a clinical course. As I'm thinking about where this opportunity for communication is, my hope was to do something in the simulation space. And I'm looking through this list and, oh, okay, there's the second one that's advanced care planning conversations. And I'm thinking about advanced care planning and I wonder, would this be a strategy that might serve what I'm trying to accomplish? So when you look at any of these resources, these have been contributed by faculty across the country. They share with us as much or as little as they want to. So you'll see some of these strategies, like this chat simulation, it's all there. She has provided all of the documents that you need to do this, I'm pretty sure. Some of them, it might just be a one page saying, here's sort of a summary of my simulation. And if you want all of the the parts and pieces, email me. Some faculty want that opportunity to talk with you a bit more about that before they just share it. Also, some don't want students to find it, so they would rather just have that opportunity to share with you directly. But you could read through this and see, okay, is this something that fits what I'm trying to get my students to demonstrate for their competence? None
And
of
of course, you
these,
can adapt them
that's what I was gonna say,
as
all of them are adaptable. Maybe there's a piece of this that you like, and other parts are like, that doesn't fit, or that's not what I'm trying to accomplish. Maybe I'm doing this in a first semester course where I can't, my students aren't ready to do all of that. So maybe there's a piece of this that I take, or maybe I am a student closer to graduation, and so I want them to go through more of these processes. Maybe I'm not ready to do a simulation. Maybe I'm just introducing this content to students. I'm wanting them to sort of dip their toe in the water with this and start practicing. So maybe what I want to do, and maybe I'm not in a clinical course. Maybe I'm in a classroom, like a lecture course. Maybe I say, I like some of what's in this sim. I'm not doing sim in my course, but how might I take part of that and make it a case study for class or make it a role play experience in class? These
Mhm.
are, again, these resources are meant to be jumping off points for you as a faculty. You can use it as it is, or you can adapt it to fit the needs of your students with the way you're trying to develop their competence in this space. So that's one way. How are we feeling with that sort of journey? Andrew, what do you want to add?
Mhm.
Because I'm
Yeah, I
sure.
wanted to just say here also that these are really exemplary kinds of resources that come from folks around the country. And I bet there's folks on this call that also have something that you think might fit. And so we welcome any contributions. And as you could see in that one, you get the authors are acknowledged here at the very top, and you can add it to your own scholarship to the profession in your own CV, for example. So it's an opportunity for dissemination in that kind of way. And there's a link on the if I go back out to the faculty corner, and I think at the very bottom here, call for submissions. So you would just send it to us this way if you have something that you're comfortable sharing out. Again, trying to break down the barriers of we all go create these things by ourselves. People have done really nice work, so why not share it with each other?
So
Questions?
one other thing that I might share is, part of this is what we're asking students to do, but also how do we evaluate that they've done it? So maybe you found this strategy and you're curious, what are some existing resources that you could use to evaluate student competence? The G-CARES statements are competencies, but they're sort of global, where, they're not necessarily directly observable. You as a faculty have to sort of think about what elements go into that for your students, right? So, but let's say you're wanting to think about is there anything out there that measures or evaluates student competence with communication? And so you go to the evaluation tab and you see there's instruments available about knowledge, about perceived competence, and about competence. So let's say I'm really interested in this competence one. So you can open that up. And there's a couple options here. One is a competence assessment tool. The first one, that's what Dr. Davis and I have created. The second one is an adaptation of the Creighton competency evaluation instrument. This works really well for simulation in particular. And then, of course, we have our G-CARES. You'll notice for a lot of these, if it's anything that Dr. Davis and I created, you'll see where it just says free access to this instrument through this link. You click on that, it takes you to a Qualtrics survey where we just want your contact information. We kind of share some information about how to use the tool. And then you just get it. You go through a couple of questions and then it gives you access to any of those tools to download to use as works for you. We
We're just trying to track who's
Mhm.
using it, how are you using it? That's all.
That's all. Yeah. And also, if, down the line we make revisions to any of these instruments, we want to be able to share the latest and greatest versions with anyone who has downloaded those in the past. So, but let's say, okay, I've gone through that and now I've downloaded the competence assessment tool, which
Ta-da!
looks like this. And I read about it. The first page talks about, some of the kind of the context within which this would work. This is primary palliative care competence assessment. And then as I look at all these behaviors that fit in this assessment tool, which is on page 2, I see the first domain is communication. I'm like, huh, interesting. Okay. So this is talking about behaviors of utilizing therapeutic presence strategies, demonstrating compassionate, respectful therapeutic communication, and then engaging in serious illness conversations. And maybe I think those are the behaviors I'm wanting them to see in this activity. This is what I'm wanting. This is how my students for me can demonstrate competence with that care statement. Um, there's also in person and family centered care, the fourth statement talks about advanced care planning. And if I'm thinking I'm wanting to do an activity on advanced care planning, maybe that's another behavior I want to evaluate as well. So with all of that in mind, I'm thinking about the cares as the competence statement I'm trying to develop. I'm going to use that simulation or an adaptation of that simulation as a way to get my students to demonstrate their competence. And I'm going to be evaluating if they can do that through the lens of these different statements. Now, our competence assessment tool, we don't have any requirements for how you evaluate. We just tell you what the behaviors are, and then you can think about how you're doing that in your school. Some schools like to evaluate competence as meets or does not meet. Some like to use sort of a developing, developed, highly developed. Some have 5 levels, whatever. We don't want to be prescriptive. We just want to say, here's what you're looking for.
Can I add one thing right
Yeah,
there?
please do.
So another idea, just to sort of plant some seeds about this instrument in particular, is that when we did focus groups with students, we had a really interesting kind of response that this would be really useful as sort of a roadmap for where you want us to go. So students said this document would be really helpful to have early on in their program as a way to say, oh, okay, so what does that look like? And have a conversation. So it can be used as a teaching tool as well with students. So that's again why there's no measurement on this. So you can decide what works best at your school.
This was designed for our entry level, our RN level students. Now, we currently don't have an APRN version, and that's because there's so many different specialties within the APRN roles and advanced level roles. If you're wanting to think about what does this look like for my students at the graduate level, you're welcome to start with this and think about, okay, for my students, if I'm teaching in a psych mental health nurse practitioner program, how might these behaviors, what would they need to look like for my students? If I'm teaching in a nurse midwifery program where I'm trying to teach them how they do advanced care planning conversations with pregnant women and their partners, maybe there's some perinatal loss, some perinatal concerns, and so maybe we're trying to have some goals of care conversations. Adapt it. That's fine too. So let's sort of oh, by the way, let's pause before we try another example and answer some questions that came up.
One question is, what are these numbers over here? And they are the alignment with the care statements, which are the ones that we right here, these 15.
So if you look at it, for example, there's 3 with communication, all mapped to care statement number 5, which is the one we're talking about right now anyway. So that's where we've sort of seen where there's a real strong connection between the care statements and the behaviors in this competence assessment tool.
There's a fun question about is there an instrument to measure faculty comfort with teaching this content? What a beautiful question. Come to the workshop next summer.
There's that, and not at the moment, but in the November, December edition of the Journal of Hospice and Palliative Nursing,
Mm.
Dr. Davis and I were guest editors of that issue. It is dedicated to palliative care education, all things palliative care education. Just as a little teaser, all faculty get free access for 3 months once it goes live. We'll make sure y'all get the info on that. One of the articles in that edition is actually about faculty needs assessments. And 4 different studies, 4 different ways faculty needs assessments were conducted from a national perspective by our team. And then also one school, one faculty and member at a school of nursing took that and adapted it for their specific institution and contributed that sort of local needs assessment piece. Once that goes live, we can absolutely put those instruments on the faculty corner as well. They're just not there yet. If you're wanting that now, email us, we can send it to you. But yes, they do exist. They're just not there yet. But please email us because that's a tool that's coming.
It's the Journal of Hospice and Palliative Care Nursing. And so not everybody is a member of that organization. So you wouldn't have access. So we have worked with the publisher to permit, there you go, for putting it in. Thank you. Free access for 3 months. And I think we're going to advertise that. I mean, if you come to this webinar, you're going to get all the information moving forward through LNEC, and that will come to you. But also, I think ACN is going to help us share that.
There will also be in that special issue some other teaching strategies, some other ideas that we've learned about through the workshop, through other expertise. So keep on the lookout. We're not going to derail too far because there's lots of good stuff coming, but that's there.
Including the workshop.
In the workshop, yeah. So let's now shift gears and let's say we're going to stay in the communication space because as we were preparing for today, it was easiest for us to think in the communication space. But let's say I'm teaching at the graduate level. I'm teaching in a graduate program. And again, I'm really trying to develop my student competence with communication. And I'm still thinking about in the sphere of hospice, palliative supportive care, even at the graduate level, right? Our graduate advanced level students are all going to be caring for patients with serious illness through their role, whatever they're training to specialize in, they're still going to have points of interaction with patients with serious illness, meaning they need to have these skill sets in primary palliative care. So thinking about that, all right, I want to start again with competence. And so I'm going to go to the G-CARE statements because those are the ones for graduate students. And you can get to them through where it says view graduates here. You can get them through the alignment documents. And when I look at this list, maybe we zoom in just a tiny bit. I look through the list and
there's only 12 for graduate.
There's 12, right. 7 says utilize advanced palliative care communication skills with patients, families, and team members as appropriate to one's functional area of nursing practice and the professional context. Great. So for me as a faculty member, I have to think about what is that functional area that my students are training for. What is that specific professional context that the students in my program are developing? Because that will be different. If it's a CRNA program, nurse anesthesia program versus a family nurse practitioner or a peds nurse practitioner, there's so many different advanced levels. If I'm in nursing informatics program, what does that look like? So you have to kind of think about, use your disciplinary expertise to situate that context. But now I think about it. So again, how do I get my students to do this? I know what I want to do. And maybe what I'm really concerned about is developing their competence in communication skills with sharing difficult news. How do I, they've been working at an RN level, but now they're moving into this advanced level role where they're the ones that may have to deliver this difficult news. So how do I help them develop that skill set? So I have this. Now I think about how does this fit with the essentials? So again, I'm going to go to the alignment document.
Sorry for all the scrolling.
Okay, we're gonna scroll past all the undergrad stuff, the care stuff, and get to our G cares pages.
Da, 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 da. So
Keep
many.
going. Yep.
I know.
There
There's
we go. Okay.
so
And we
page
can see.
25,
Yes.
graduate shows up.
We want to zoom in a little bit.
Yeah.
So
Come.
again, I'm going to go to statement 7 because that's what I'm thinking about. Now, you might find, I want to work on 7 and 12. I don't know. We're just going to pick one to start from. Okay, so I've got this one, and okay, I'm really thinking, all right, again, looking through these essentials documents, saying, okay, I see where there's alignments with certain subcompetencies. You would do the same thing. Look at concepts. Where do I see those alignments with the concepts? And with that in mind, okay, so maybe we're still in that person-centered care space. Maybe there's an element of professionalism here. There's maybe some aspects of knowledge and nursing practice that come in. It depends on your conceptualization, your vision for what you're wanting your students to do to work towards this competency. Now, let's say, so the first example we provided was, if you're just wanting to use the faculty corner, maybe you're not using the modules to get the faculty guides that go with each of the modules. You receive those when you request access to the online curricula. So when you email LNEC to ask for access to LNEC undergrad, you get access to those modules and then they send the faculty guides. Same thing for graduate. Let's say I've emailed LNEC and I've said I would like access to LNEC graduate, and they said, here's your free access to the modules. I'm going to work through the communication module because I want to know what's in there.
I just want to point out where they can do that. So if everything is really here on the faculty corner. So if I really want undergraduate online curriculum, student and faculty access right here.
Is there a question?
No.
So let's say I've gone through the module and okay, I have 6 faculty guides. I just want to look at the communication guide that comes, the faculty guide for the graduate communication module, which is here. So you'll see this. The undergrad and the graduate guides are pretty similar in how they're organized. We did add a little bit more. We learn every time we go. So we have some instructions for use here as well, but these apply. So the first page of every guide is information about the module itself. That's great. I just want to get into the teaching strategies.
Right, let's
So
get
I'm going to
down to
scroll
it.
down.
This is the fun part. Here's the teaching.
Yes.
Here's the fun part.
Again, I'm trying to, okay, what do I want my students to do in class or in clinical or wherever to demonstrate that they are developing their competence in delivering, having a difficult conversation. And I'm looking through this list. I'm reading through some of these titles, and let's see what jumps out. Sharing, look, there's this whole section of the graduate module called Sharing Difficult News. What does that look like? So maybe I really want to do a case study. And so maybe I want to look at that case study, Sharing Difficult News, 3 scenarios. Our faculty guides are all developed where you click on the thing and it hyperlinks you directly to. So you don't have to scroll to page 20. You can just click on that. And it should jump to
I'm going to take
20.
us down there, okay?
Ta-da! It hyperlinks. So we're on page 20. Okay, so I'm looking at these different scenarios. And do I see, as I'm reading this, and by the way, Teresa Giesba, who's on our call, one of our LNEC regional chairs, this is from her. Right. She shared these strategies. So I'm reading these cases and maybe like, oh, I like that. I want to do that in class with my students. Or maybe I teach in a fully online program. And so they're not in class with me, but again, I still want to see them demonstrate it. So maybe I want to have them do this case study as a discussion board. Maybe I want them to have to do a video where they record themselves responding to this case study. Sky's the limit. How you use it is up to you. It's what makes sense for your teaching situation, your students, what you're trying to have them develop their competency with. So maybe it's one of these. But maybe I look at these, I'm like, no, maybe that's not what I want to do. again, there's all sorts of other ones. We might scroll up a little bit because I saw, oh, there was something about a simulation or some
Oh,
role
I'm gonna have,
playing. Oh, what
yeah,
is this?
I'll go back up here. So there's this case study, goals of care conversation. This is also something that you might be doing, and these are tailored towards the advanced level.
Mhm.
So here's a goals of care conversation, and it gives you the scenario and prompt questions for discussion.
Yep. And this is a role play exercise. So, okay, maybe I do want the students to partner up and to do this. Maybe it's, there's lots of different ways you could do it in online spaces and in in-person spaces. One of the things is your program best. So we're not at any point prescribing you must use these strategies in a certain way. This is again a launching point. This is here's what we find are some scenarios you might consider. You can adapt them. Maybe you're not maybe you like this scenario, but you're really not in a cancer space. Okay. How could you take, an idea? I'm just going to throw it out there. Take that case study, throw it in AI, use ChatGPT or Copilot or something and say, hey, take this case and modify it to be about, you know, uh,
COPD.
COPD, or maybe it's, I'm really wanting to lean more in, my students are in a psych mental health nurse practitioner program. So I'm really wanting to focus this more on depression or something,
Mm-hmm.
whatever makes sense. But if you like kind of where this is going, use AI. It's really great
Mm-hmm.
for helping to, adapt case studies, that sort of thing. Um,
Maybe
so
a
maybe
good
that's what I do.
maybe a good point for a pause, or we can
Mhm.
show, we have 15 minutes left. We can show the undergrad complement to that.
We could, yeah. Also, one other step for this would be okay. I found the strategy. I know what my students to demonstrate. How do I make sure that they develop their knowledge related to that prior to them coming to class, doing this difficult news? Maybe you assign them to complete the LNET communication module in the graduate curriculum. If
Mm-hmm.
you're not using that, I mean, again, we love our curricula. We stand by them. We think they're great. But if you're like, I'm not using that, or I want to do something different, then you can create, do whatever you feel is best. Assign your students whatever preparatory work, whatever. If you want to do a lecture, great. If you want to do something else, that's fine. We're not saying at all you have to use modules to use our LNEC resources, although we'd love
No.
you to.
Mm-hmm.
But still, before you can do any of these strategies, before you ask your students to do any of this, we have
Mm-hmm.
to make sure that we are making sure that they have the knowledge from which to work. So
And
thinking about how do you give that info?
one to back up also is like we're all beginning from with our course objectives potentially, right? You could be looking at it from program outcomes, or you could also be specifically imagining how you would situate it in a given course. And so you start with those objectives, and then you kind of can walk through this whole process that we've outlined here too. But it ends with the fun part, which is the teaching tools and strategies. So that's why we hope that these are really useful for folks, both the faculty corner that has different resources as well as these guides. So here's the undergraduate version for communication. If you want to look at one.
The faculty guides, they're not located online. The way you get access to these is you email lnec@coh.org. I'll put that in the chat. And you ask for faculty access to either undergraduate or graduate or both. Faculty get free access to either or both. And when they send you, yes, here's how you can access the curriculum for free, they will include in that email the faculty guides. Oh, thanks, Andrew. One other thing to think about too, thanks for bringing up, your course objectives. It might be very likely that the course you're teaching doesn't name palliative care, doesn't name serious illness in the course objectives. Maybe it's not even in the course description, but as you're thinking about, you want to prepare practice-ready nurses, a big part of that is, can they do this work with patients who are living with serious illness? So maybe you have the course objective is about communication and it's global. And so maybe it is you have some communication things where they're doing in a community setting, but why couldn't that patient in the community have serious illness? And so you're thinking about also, you don't have to completely overhaul your courses or change your course objectives to
Exactly.
specifically say it must be palliative care. We know that these competencies are part of being practice ready, that because serious illness is everywhere. So being able to do these skills is important regardless of specialty, regardless of practice setting. So even if it's not named, can't how could you use these strategies, these competencies to say, I understand we're not necessarily specializing palliative care, but my students still have to be able to do this. So I'm still going to situate this in a palliative care context, even if the course doesn't necessarily call for it. Now, that said, let's say you're teaching in an acute care geriatric nurse practitioner program where you're very much in an acute care space. Palliative care still is there too. So maybe it is a patient who's in critical care with serious illness and is needing to have a difficult conversation. Bring the palliative care into that because that's an important part of that skill set.
So I just feel like there's a whole lot of people here who have lots of ideas about that. And I think one of the things that we're really trying to do is give examples of this thing, that idea that we've lobbed onto a couple years ago to help reimagine when, where, and how we do this. Like, Megan's giving you all kinds of examples, say this, say that, to really be thinking outside the box, that it doesn't have to look a particular way. It doesn't have to be within the context of, hospice, for example. There are just so many different ways for you to think about integrating this again into what you're already doing. Yes, thank you. Reimagine.
I mean, we know making any change to your course description or course objectives is a multi-month, multi-step process through curriculum committees and faculty governance and all that. So you don't have to wait. I mean, if you want to revise your courses, if you want to have standalone dedicated palliative care courses, great. But you as a faculty can start doing that work now of, again, bringing the palliative care into this because it's essential for being practice ready. So we do have about 10 minutes left. So let's
Okay.
stop sharing maybe. We do have one more slide we're going to share, excuse me, at the end. So we're going to, at the 2 minutes too, we've got some exciting announcements, but we will first open it to y'all. So any questions, anyone who's really struggling to figure out how to do something in their course, or if they have an exciting idea they want to share, the floor is for y'all now.
Dr. Lippy?
Oh, we'll do Cheryl and then Susan. Suzanne.
Oh, okay.
Sorry if I said that wrong. Cheryl? Yeah.
No, I was just going to say I enjoyed the faculty conference in July with you and Dr. Davis and Dr. Farrell. And I was just telling Dr. Davis that my research question for my pilot study in the spring is how baccalaureate nurse educators form their opinions on the AACN guideline for one of the 4 core spheres of nursing care in the BSN curriculum to be devoted to palliative, hospice, and supportive care.
Beautiful.
That's exciting work.
It is. So timely.
Best of luck with your study.
Thank you.
Suzanne, I'm sorry, Susan or Suzanne, please correct me with how I'm
Suzanne.
supposed to say that.
It's okay, Megan. I was out with you guys last summer, and I've been working very hard to get things done around here. And the first place I implemented was in my new grad residency program. I'm 1 day a week at the local hospital. And I was able to have 6 residents complete it last year with excellent feedback and the policy change at the hospital.
Wow.
So their palliative care policy was all about hospice care, and it wasn't truly palliative. So from the education, for their GN evidence-based practice project, they created a palliative care policy that is going through committee right now to get implemented.
Wow.
So I'm very excited about that. And then for the university, I'm at St. Bonaventure, we were able to start it in our master's entry into practice last in January. So they did it the first three modules during foundations with clinical in a nursing home. And then the second three modules over the summer in their advanced assessment class, and with great debriefings and simulation. And all I use a lot of the stuff off of the website. And then this year, just right now, this semester, we were able to implement it into our RN to BS program. I'm doing the first three modules in advanced assessment. And then I'll be doing the second three modules in the spring in our transitions and care class. So none of it is called palliative care, but it's all related to palliative care.
Wow, what a beautiful example.
Yeah, it's great. And I've had a lot of great support from administration at both the hospital and here. So it's good.
Oh my gosh, that is so exciting
So
to hear.
thank you for everything that you guys did.
Oh, well, I got goosebumps. So thank you for all the work
know,
you're
you
doing.
just made our day.
There's a question from Amy. Could these undergraduate information, could it be adjusted to a program for nurses and CNAs in a long-term care facility? Absolutely.
Absolutely.
Absolutely. Again, what primary palliative care is doesn't change. It's the scope of practice within which an individual is stepping into that palliative care space. So, for your CNAs, you might go through that and see, there's elements of this that fit. Maybe there's a strategy, especially in those teaching strategies or those simulations, maybe it's about adapting. And I am a big fan of AI with some of that stuff, saying, okay, it's this level, I want to level up, help me with that, or I need to adjust the scope of practice for this. Like, have it do some of that heavy lifting, and then just allow yourself to be in that space of how do you creative and, align it with what you want it to be. I will say, I mean, even with the graduate guides in particular this year, we used AI for some of that. We're like, we know what we want, and it helped us to just write it to make it clearer and that sort of thing. So even the title for this webinar was AI generated because we knew what we wanted to say. We asked it to tell us how to pick a good title. So you can use AI for some of that, and then you use your expertise to make sure it's correct and it's appropriate for that scope of practice.
Do we have any other questions? Or I really appreciate that, Suzanne. Those are such great examples of how you sort of scaffolded what you took from last summer and integrated it in a variety of settings, and none of it was palliative care necessarily. So love that.
Gloria asked, will the recording be on the website? Yes, not today, but in the next couple of days. And we always communicate back out to everyone who attends the webinar with information about the recording, but it will be on the website, hopefully in the next week or so.
Okay, so there's another comment about having used these in the ADN program. LNEC was a great resource, so that's wonderful to hear.
The whole college got trained. That's amazing. Woohoo! Great job.
Can I just, yes. Hi, this is Ratna. Can I get a few seconds to share my experience? Yes, we did get a grant to include end of life content to the existing curriculum. Being an ADN program, there are limitations for increasing the credits. We couldn't do that. And we also needed to look at a long-term plan for sustaining this information in our program. That's why we couldn't purchase all of your resources. So what we did was, take the whole, curriculum, mapped the contents, weaved them through each course. And it took several years to match ASENs and all of those objectives. And within the student learning objectives and the existing objectives, we included them. And I have to say that it is a great success. I was one of the key people in doing this, and I'll be presenting at OATN conference this topic of how we did this. And thanks to LNEC, a great source, great information, and that was my platform where I jumped to every time I needed some help. And
Great.
yes, we offer the courses to the entire college, not just nursing, but to all disciplines. And I think so far, about 50 to 60 faculty have been trained in these courses through LNAC.
Wonderful.
Yes, thank
Wonderful.
you.
Ava asked an important question, and if anybody has any ideas about that online, we only have 3 minutes now, but if anybody has anything to share, that'd be great. Otherwise, we can connect with you.
Mhm. Eva, I just sent you in a private message that how you can email each of us to set up a meeting, or we also have a colleague who does teach in that space and can help you. And that's the thing, just know any faculty here, if you have those sticking points, whether it's I'm trying to move this through my curriculum committee and I'm just hitting roadblocks, like this is what we love to do. This is what we're here for. So you can always email LNEC or email Dr. Davis, me, both of us. Email both of us because we like to work together on these things, but we are here to help strategize and help find solutions, and help you think through your specific situational, challenges. So please know we're here to help you with that. It's just we're an email away, and happy to meet with
Pop your
you.
email in there, Megan. I just
Mhm.
put mine in. And as we close out, we want to announce the next month's webinar, which is exemplars from faculty that came to the workshop this summer, and presented or did a poster on some of their really innovative work at their school. And we have invited 3 of them to present. And so they'll each get like 15 minutes to share what they're doing. So it's more examples of how they're doing this work. Very inspiring. And then if you have not attended our workshop previously, we invite you to consider putting it, at least marking your calendar at this point, and holding the 16th and 17th at University of Portland. We will have grant funding to do everything except feed you dinners and get you here. So that means registration is covered, housing, dorms, and breakfast and lunch on the 2 days of the workshop. It is in conjunction with a really fun jazz festival that's free about a mile from the school that weekend. So just a little teaser.
No,
And we'll
this
be
year was
sending
fun.
out.
Communal bathrooms. It was a
It was
throwback
a
to
great way to
days gone
end.
by. It was great.
And those applications will open up in January. So again, you will get notified about that now that you're on our email list.
And so many of y'all, I mean, we recognize a lot of
Yeah.
names. Some of you attended. Please let your colleagues know it is not a limit of 2 people per school ever. I mean, if you've got colleagues you're doing this work with from your school, encourage them
Yes.
to apply. We have spots. We're always happy to fill them. So
Mm-hmm.
we would love to have your colleagues come at your
Yes.
institution, not at your institution. If you've got friends doing this work,
Mm-hmm.
let them know about it. It's a lot of fun. So. All right. Well, with that, we are at time. So thank you all for joining us. We hope this was helpful. Again, a lot of moving through the parts and pieces, but once you have those on your computer, then it just is the fun exploration piece.
Right.
And again, that one slide kind of toward the beginning says what all those resources are that we talked about. So if you need a reminder of where all did we take you,
You'll get that.
this recording's here as well. So thank y'all, and we look forward to seeing you in October. Have a great rest of the month, and we'll see you soon.
Bye-bye, everyone.
Bye.